Are you tired of getting the same old advice about health checkups that everyone else is giving? You know, the ones that leave you feeling like a hypochondriac, or worse. Like your doctor doesn't really have your best interests at heart. Well, in this video, we dive into some often overlooked, but crucial health screenings and tests that can actually be harmful if performed on someone over 70. Yup, you heard it right. We're returning the tables and discussing the medical procedures that might not be as beneficial as they seem once you hit the big 70. Stay tuned, because by the end of this video, you'll be armed with the knowledge to make informed decisions about your health. So let's jump right in. Number 1. Routine blood pressure checks. Now, blood pressure monitoring is a standard practice for many, but it's especially prevalent among seniors. However, frequent blood pressure checks may not be the blessing we once thought it was. Why, you ask? Well, according to studies, repeated blood pressure checks can lead to a phenomenon known as white coat hypertension. In simpler terms, when patients visit their healthcare provider, they often experience elevated blood pressure readings simply due to anxiety associated with being in a clinical setting. This condition, known as white coat hypertension, has been reported in up to 20% of patients. But what's even more alarming is that some individuals may suffer from masked hypertension, where their blood pressure is consistently higher outside of a clinical setting. Therefore, it's essential for those over 70 to consider the frequency of blood pressure checks. Is it necessary to measure it during each routine checkup, or would alternative methods such as home blood pressure monitoring provide a more accurate representation of one's health without the added stress? No. 2. Routine colonoscopies. Colonoscopies are essential in the fight against colon cancer, a disease that knows no age limit. But did you know that routine colonoscopies may be more harmful than helpful for those over 70? Let me explain. While it's true that colonoscopies can help detect and prevent colon cancer, studies have shown that people over the age of 75 may not benefit as much from routine screenings. One of the primary concerns is that colonoscopy carries a small risk of complications. These can include bowel perforation, bleeding, and infection. While these risks are rare, they can be more significant for older adults who may have weaker immune systems and other health conditions. Furthermore, there is limited evidence to suggest that screening benefits outweigh the potential harms for those over the age of 75. This age group may choose to focus on other preventive measures, such as maintaining a healthy diet, engaging in regular physical activity, and avoiding tobacco and excessive alcohol consumption. Of course, this doesn't mean that everyone over the age of 70 should avoid colonoscopies altogether. It's essential to weigh the risks and benefits on an individual basis, taking into account personal health history, lifestyle, and preferences. If you're over 70 and unsure about routine colonoscopies, don't hesitate to discuss it with your doctor. Together, you can decide what's best for your health and well-being. 3. Routine blood sugar and A1C tests. For those over 70, routine blood sugar and A1C tests might not be as straightforward as they seem. You see, while it's true that managing blood sugar levels is crucial for overall health, especially for older adults, these routine tests can lead to unnecessary interventions and potential harm. You're probably wondering, what do I mean by that? Well, let's break it down. Firstly, routine blood sugar and A1C tests may not accurately reflect a person's true health status. Older adults often experience age-related health conditions like decreased appetite, changes in metabolism, and reduced physical activity, all of which can influence blood sugar levels and potentially lead to false alarms. Moreover, these routine tests may not always be necessary to diagnose diabetes or identify individuals at risk. The American Diabetes Association recommends that adults over 65 should only undergo A1C testing every 1 to 2 years unless they have specific risk factors for diabetes. By reducing the frequency of these tests, you can minimize the chances of misdiagnosis and the potential harm associated with unnecessary interventions. So if you're over 70 and have concerns about your blood sugar levels, don't just rely on routine tests. Instead, adopt a holistic approach. Consider your overall health, consult with your doctor, and take steps to manage your blood sugar levels through diet, exercise, and medication when necessary. No. 4. Routine bone density tests. As you get older, maintaining bone health becomes increasingly important. And for those over 70, routine bone density tests may seem like the best way to ensure everything is in check. However, according to recent studies, these tests might not be as beneficial as we once thought. But don't worry, I'm not suggesting you abandon bone health altogether. Instead, we need to take a closer look at the risks and benefits of routine bone density testing and consider whether it is really necessary for everyone over 70. For instance, if you haven't had a previous fracture and don't have any risk factors for osteoporosis, routine bone density tests might not be the best use of your healthcare resources. Additionally, these tests expose patients to radiation, which can increase the risk of cancer and other health problems. That's why it's crucial for individuals over 72 have an open conversation with their doctors about bone density testing. By working together, you can develop a personalized plan that takes your unique circumstances into account and helps you maintain strong bones without unnecessary risks. No. 5. Routine prostate cancer screening tests. When it comes to prostate cancer screening, not all tests are created equal, especially for men over 70. You see, while early detection is crucial for many cancers, prostate cancer is a bit different. Some experts argue that finding prostate cancer early does not necessarily improve survival rates and may even cause more harm than good. So let us take a closer look at some of the common tests used for prostate cancer screening and explore whether they are really necessary for every man over 70. One of the most commonly used tests is the prostate-specific antigen, or PSA blood test. However, studies have shown that PSA levels can be elevated for reasons other than prostate cancer, leading to unnecessary anxiety and further testing. Another popular method is the digital rectal examination, or DRE, although the DRE can help detect abnormalities in the prostate. It's not always accurate and can be uncomfortable for patients. So what should men over 70 do? Well, the answer isn't straightforward. It requires careful consideration of individual risk factors, family history, and personal preferences. Having an open conversation with your doctor about the risks and benefits of prostate cancer screening tests can help you make the best decision for your health. Remember, it's your body and your choice. And with the right information, you can take control of your health and make informed decisions about the tests you want to undergo. As we wrap up our discussion about the 5 health checkups that can be harmful for those over 70, remember that knowledge is power. By staying informed about the potential risks and benefits of certain medical procedures, you can work hand in hand with your doctor to develop a personalized plan that suits your unique needs and preferences. Don't settle for a one-size-fits-all approach to healthcare. Take charge of your well-being and make choices that empower you to live a healthier and happier life. Now, we want to hear from you. Are you over 70 and have you had experiences with any of these health checkups? What are your thoughts on the potential harms they may cause? Share your stories and insights in the comments below. Your experiences can help others make informed decisions about their own health and well-being. Also, if you found this video informative and helpful, don't forget to hit the thumbs up button and share it with your friends and family. By supporting this video, you'll help spread awareness about the potential harms of certain health checkups for those over 70 and empower more seniors to take control of their health. Thanks for watching and stay tuned for more informative videos. Until next time, happy and healthy aging.